Utah. Okay, so you will bear witness that I pressed record because we've had a few disasters.
Talking about recording, was the narcissist uh session ever recorded? I know you had written notes.
We had one with the written notes. Then we did actually. Yes, I think we did. I think one or two came out. I'm not sure.
So yeah, if there is a recording and if you could post that, I'd be very happy to hear it.
Okay, I can post it in this group. Yeah, post
Thank you.
EMDR. Okay, I've made a note.
Starting.
Okay. Gosh, you are cold.
Yeah, I'm freezing.
Oh no.
A shame.
It's really, really cold.
Oh,
Yeah. Anyway, so let me at least get started. I just wanted to quickly give you an overview of this seminar that I went to. I know that several of you have mentioned about IFS along with EMDR. And I've been trained with IFS. I wouldn't consider myself a Baki in it, but it was a very interesting seminar in the sense that, first of all, um, the person who organized it asked me to present on the protocol that I developed, that I trained you on. It's he saw it on my LinkedIn account, and I got very interesting feedback. First of all, the more senior level clinicians have also developed, or at least use things in their protocol that are similar to what I've changed, and I got very good consensual feedback that the changes that I've made, I think, are valid, especially in the ordering. They also really like the trauma history and the schema analysis, the schematic analysis. They were very interested in that. They encouraged me to publish this, which I think I'm going to do. I'm gonna write an article. Now that I've gotten that feedback, I am going to try to publish an article. But the thing I wanted to mention about that piece is that um, two of the more senior clinicians, when I mentioned about the fact there was some controversy here about doing a different protocol, um, they said that there are innumerable um, versions of the standard protocol that have been out there, and that one woman in particular, who happened to be a Bukharian Jew, has her own training company and does her own protocol without being trained by Emdria, just like me. She has a whole company and she's doing training. And of course, she said that Emdria is not exactly happy with her, but she is doing training in a way that's very similar. And I mentioned that I don't think the EMDR Israel people are very happy with me either. And she said, join the club. But this is, besides the fact that it's a free economy, but the reason why she did her own company is the same exact reason why I'm doing it, is that she didn't agree with the standard protocol. So I felt very validated. I felt that what I'm doing, what we're doing, was validated, and that we're not going to allow politics or territoriality get in the way of doing good training. So wanted to share that with you. Next, in terms of the IFS, how many of you have been trained in IFS? Okay, I don't see two people off camera, so two of you. I know that at least two other people that are in this group that aren't on have been trained. To what degree do you think it would be? I'm not ready to do any training. I have to really. I think I need to do another. another intense training in IFS so that I feel like I'm really competent. But is that something, Susan, you think people would be interested in general to integrate IFS and EMDR?
Yeah, why
Yeah.
not?
Yes.
Oh, there's Tova.
Yes.
Okay, so
I think so too, Nechama.
Yeah,
so
that would be great.
the question I have, I have two options. One is to wait until I get further training to do a real proper training. And the other is to do kind of like an overview of what I learned, but not a specific training. That I'm prepared to do now. Is that something you ought to be interested in terms of just understanding some general concepts of the integration between IFS and EMDR?
I
Yes,
would like to know more about it. I know almost nothing, so.
me too.
Yeah.
I
I think,
think it would
and
be great for everyone because, for example, people like me that know about IFS, so like it'll already like give us this, okay, what did you learn so far? And people that don't know about it at all, it'll help them to understand how much they're interested in a training with IFS and EMDR. And then it'll help when you are ready to give a more proper training. And perhaps it'll help to, people to like register or whatever, like go ahead or not or whatever.
Okay, all right, that's a very good point. I would strongly encourage anyone who has not been trained um, to find a training. There is online training opportunities. I was trained online. I didn't go through, but I don't feel as competent to actually do a formal training yet. But I ended up having a good relationship with the person who runs the company that did the training. And he said that he would help me to put together a training program, but I have to go through a more intensified training experience before I feel competent to do that. But I am willing to at least talk about it. And maybe,
if I may, sorry, my feeling about it is I think it is a great idea eventually to weed in the different types of modalities. But what I feel right now, we're just, and everyone can correct me if they're wrong and wherever you guys are comfortable with, I feel like we're only starting to know about EMDR now. So would it make sense to wait a little bit because we all need to first feel comfortable doing the protocol first to know how to weave in the other modalities? Does that make sense? Or that doesn't,
no,
or you could technically,
it certainly makes sense in general, and that's why and besides the fact that I'm not ready to do any formal, you certainly aren't. However, I think it does make sense to at least do an introductory um, seminar or an introductory session on what IFS is in general to pique your interest, because just because you're just learning EMDR doesn't mean that you can't start learning another modality.
no. And of course, and sorry, just to clarify what I was trying to say, 100% that we are all learning the different modalities, but I thought the question was directly, do we do EMDR with IFS and in this case in specific?
No,
Meaning I am with you and there are other CBT, like there are other modalities as well that everybody is comfortable or not, or learning to be comfortable with these different modalities. But if you were to say EMDR and IFS, 100%, I feel I am with you. And I feel even for those who don't know IFS, to have that introductory lesson session or whatever we want to call it, 100%. But to get more comfortable with EMDR first, to then know how to weave in IFS. I think it's like two-part questions.
well, how do you all feel about that?
I think that people are at different places with their EMDR. I'm saying, for me, I would welcome hearing about your beginning integration of EMDR with the IFS, because I've also learned some IFS, but I haven't really, I don't know either one so well that I would know where they meet. But I could see, I mean, I see about how I use other kinds of training that I've had, like motivational interviewing and I'm trying to think of the name of it, solution focused brief therapy. I mean, I bring those things into my EMDR because they're just tools that are useful that augment the EMDR. And to hear a little bit about the beginnings of how the IFS, how you are integrating them in a beginning way, I really would welcome that.
Okay.
So I want to just add and clarify a little bit more what I said. Maybe I'm not understanding, but I thought it was maybe just this time to like just spend some time just learning what you learned at the seminar, and there's always other sessions until you're doing until you're ready and trained to do like a specified training on EMDR and IFS. But it's just sort of like a common like just like this like it's as if like a page in a textbook, you know what I mean? Okay, like let's just like veer off a little bit, you know, like meaning I'm really just starting with EMDR. I honestly haven't even been able to focus on EMDR because I just got trained in IFS and I had to be focused because I was just in the intense training. So in a way, it's actually helping me to go back to EMDR and say, okay, so, and it might help like even those of us that are just starting with EMDR to just realize how we can be flexible with it.
Yeah.
Meaning,
Let's do this. And I didn't want to spend the whole time. I really want to get to your experiences. Let's do this. I'll schedule with Susan in the next few weeks a session, which would be I would call a IFS primer or IFS EMDR primer, and just talk about general concepts, answer your questions, encourage you to get trained in IFS. And if you are already trained in IFS, give you an opportunity to at least start the general discussion in your mind about how to integrate. Is that fair? Does that make sense? Okay, good. All right. So let's open up the discussion. Talk to me about how you're all doing in terms of practicing EMDR, experiences you've had, questions that you have, concerns you have, whatever, wherever you want to start. Well, let me ask you this question. How many of you have started to integrate EMDR into your practice? Have you? Okay. I'm curious as to those who haven't, what holds you back?
For me, I've got at the moment very little clients, so it's picking the clients when they're ready to do it. I have got 2 that I want to do it with, but with scheduling and everything, it hasn't been appropriate. But I have 2 clients that I've pinpointed that I would like to do EMDR with.
Okay. Anyone else who started and would be willing to share what's holding you back?
with me, I was like, because they're all virtually, so I've just been a little bit hesitant, like they haven't gone, and none of them yet got the machine. Not all are interested. Like I did speak to a few of them about it, and I once tried like with tapping or whatever it is with one of them, and with her ADHD, it didn't go so well, I don't think.
Yeah. So let me be clear. You don't have to have the TheraTapper to do it remotely. You can train them to tap it, which is very simple, left, right, and then to get them to track the eye movements with the stimulation in the hands, so that when you hit your right leg, you move your eyes to the right. You hit your left leg, you move to the left, and go like that. So you're not tied to the TheraTapper. There are some people who prefer the tapping over the TheraTapper. They feel they can control a little bit more. Anyone else?
Yeah,
I
for
mean,
me,
I really haven't been working. I've been going back and forth, still on the Cav of I'm now in New York, Israel. So I haven't felt that I could be responsible enough to really start taking on clients or trying to figure it all out. So and that's where I'm at.
Yeah, so let me just make this comment. EMDR, if it's an acute trauma, if it's something specific, remember we talked about acute versus chronic. You don't have to. It doesn't have to be part of an overall therapeutic relationship. You know, if there's someone that has gone through a trauma, you can give them relief in 1 or 2 sessions. So I would encourage you that if you do have an opportunity for someone who has been traumatized, to give them some relief, to at least try, and this also gives you some opportunity to practice. Rafi, you were going to say something?
yeah, I guess I was going to say, I was going to say that I think part of it's been trying to find, the acute memory in a sense. But part of it is, I try to work very relationally, and I do find it just feels very weird doing therapy with Ivan. Meaning, I understand why it would work, but it doesn't feel like relational to me. Like, maybe there's a way to do that differently.
Doesn't feel relational, is that what you're saying?
Yeah.
Mm-hmm.
I couldn't feel connecting. It's just like almost like, you know, I'm just working on you as opposed to like a relationship connection in a sense. I've only done it
Yeah.
once with a client. And again, it just might be my feelings about it, not necessarily based on any experience.
Can you tell us a little bit more about why or in what ways it doesn't feel relational to you?
I guess I feel for me, relational means connection, speaking to each other, looking at each other, as opposed to, at least myself, like I found trying to do therapy while using IV was somewhat distracting. Although at the same time, obviously, it does have some, scientific whatever benefit.
Yeah. Well, it's an interesting point. I think I think you could expand a little bit the paradigm of relationality in the sense that even though it is a little bit of a departure from the typical one-on-one therapeutic relationship where you're looking at each other and there's a connection. I have found that when you are dealing with a trauma with a client and you've gone through it successfully, it actually strengthens the relationship. It strengthens the connection. It doesn't have to be with their eyes open. Your presence and your facilitating that deeper healing can be a very strong connection building in terms of the relationship. So I would try to be more flexible in how I define relational therapy, because allowing you to enter their trauma world and to go through that protocol and to help them and to facilitate them to get to the other side of the trauma and to participate in that healing experience is a deeply connecting experience for the two of them. So I would strongly urge you to try to be flexible in how you define it, because it can be a very strong. I mean, I know that when I've done the EMDR with the soldiers, and Chama was trained with the connection with the soldiers was very deep, and I just met them. Does that help at all, Rafi?
Yeah, like I said, I think part of it's more like a, so to speak, gut feeling than any experience. Like, it's just like I am maybe nervous of how that may impact the relationships I have with my clients now, which it could be post trying, I'll see that actually.
Yeah. I would just encourage you to look at it from the standpoint that it can deepen the connection.
Rafi, what came to mind when you were talking for me, and I really went through just the training with you, Norman, was that I felt uncomfortable with the fact that it was very scripted. That's what, and I don't know if that's what you're feeling also. And again, I haven't really been practicing it, so I know you could kind of tailor it, but that's what was a little unnatural for me.
Mm-hmm. So that seems to be valid in certain ways, and there is a little bit of a impersonal, or it's an inorganic aspect of following a script. At the beginning, you're going to be following the script and reading it, but as you develop more facility and more ease and more comfort with it, you're not going to be reading from it. It's just going to be there's going to be a flow to it. If you recall, when I did the sample, for those of you who did it at the beginning, I did it with an Israeli woman, and for those of you who did it later, I did it with Abigail. Did you notice I wasn't following a script? It was
Yes.
something. It was organic. It was part of the relationship. That's going to take time before you get there. But at the beginning, there is a bit of a that inorganic feeling that you're reading from a script. But the goal is to be able to have that internalized to the point that it becomes more fluid and organic. Does that help at all?
Yeah, I just felt like naturally I wanted to take it to different directions, and I was like, okay, like maybe I shouldn't, maybe I need to just stay focused here, and go through the script. Again, I basically did it during the workshops and maybe a few times afterwards, but not many. But I wasn't sure, again, I wasn't,
Well,
you're much more comfortable, so you know how to.
Correct. Look, I've done it for many years. But I think, first of all, I would encourage you to stick to the script now and get it down pat. If you feel that there's something you want to modify, that's what I did. You can modify the modification, if you feel that something makes sense to you. Nechama, you want to say something?
Yeah, I wanted to say that I think that the script it's a structure. It's an outline. It's really an outline, and I really feel like, yes, I mean, there's a certain faithfulness to it. Otherwise, you're not doing EMDR. But I think that, like, even let's say in the history taking, it's just like whenever you do an assessment of a client, you're building a relationship with that person, and showing them that the way you listen to the way they're telling their trauma history, that you're creating a relationship with them. And I mean, look, the person has to be, you have to obviously get their kind of informed consent, but they're sort of consenting to something that's a really whole new world. So the informing part is, I'm going to take you on this journey that's unfamiliar to you, but in order for you to come along with me, there has to be a certain a leap of faith almost, but it's the very basis of how you're creating a relationship with them.
But that's
I think.
but that's the standard kind of intake anyway, isn't it? As you've just said, you're forming a relationship with a total stranger, and it is a leap of faith on their behalf, and also on our behalf to a certain degree as well. So EMDR, because it's not a natural language to us, the way that the way we follow the script, but we can use our own language and make it more authentic for ourselves, as long as we're following the protocol, which is really important, because you need to be authentic in that. So if you're authentic, the client feels more comfortable, which develops a deeper, meaningful relationship. That's how I see it.
In some ways, this is dialectic. On the one hand, the structure of the protocol can feel impersonal, artificial, not organic. And on the other hand, there is a certain comfort of knowing that there is a structure to this process that does lead to a successful outcome. And if you're trying to, if you know, there is that dialectic between the organicity of the relationship and also the authenticity of the outcome, that it generally leads to a successful outcome of resolving trauma. And when you get to that point where the trauma has been resolved and the person feels desensitized, they were able to reprocess and put it in a different frame that gives them a tremendous sense of relief. There is a relationship building aspect to that you went through it together, and you helped them get to the other side. So I think if you focus on the artificiality of the protocol, it's going to be uncomfortable. If you focus on the connecting value of achieving that trauma resolution, it should feel, you allow it to feel more comfortable because you've experienced it together. Make sense? There was somebody had a hand up. Okay, go ahead, Abital. And then I think Tova was waiting first. Go ahead,
I think
Tova.
it was
Yeah, I don't mind.
Sharon, Tova, and I was last. So if you want to do it like that, Sharon, you can go first.
You said that I should go first? I wasn't sure.
We haven't heard from Tova yet, so go ahead. Go ahead, Tova.
Go to.
Oh, okay. Can you hear me?
Yes.
Yes.
Yeah.
Oh, okay, great. I just want to share, I've been using it and I've been really amazing. So I do it in my own interesting way with all my different modalities. So I have I'll give you just one example with one woman who came in, she's pretty new, and I started with her with that, but I had her lying down on the table. So we were doing some, body type of work, opened her up. Then I do something called transforming touch that also opened her up. And then I added in the EMDR. She had two very serious things that she was very triggered over. I'm not going to call them big T trauma, small T traumas. They were traumas for her, big ones. And with one of them, we really concentrated so far on really one of them, both of them, but one of them, she really saw a change. She was really desensitized from what she was triggered about, and she was able to. It was about her daughter-in-law. She couldn't stand her, and she just couldn't even stand her children. And this daughter-in-law just had another baby, and she just was able to bond with the baby. She started to feel like love for her daughter-in-law. She was desensitized from anything she was feeling from before. It's not completely gone, but she has, certain issues with things, but she's feeling love for her, which is a new thing that came on board. So I don't know. I'm seeing like pretty good success with it. And there are a few other cases I've been working with. People have just been even holding the TheraTapper. They're remembering, like one woman just remembered that she was sexually abused. When she didn't, and I've been working with her for years. And all of a sudden it came up, something happened to me. And it came up only after she started using the TheraTapper.
And why, and this is for anyone, what do you think it is about this process of the bilateral stimulation that can stimulate repressed memories? Go back to the training. What is it about that bilateral stimulation that can trigger these memories?
Getting it unstuck from one side of the brain to the other.
Okay. What specific area of the brain is involved in memory?
Hippocampus.
Hippocampus. So what's happening is that when you do this bilateral stimulation, you're actually stimulating the hippocampus, and it can help to access memories that were previously repressed. I told you the story about the guy who remembered that he had been sexually abused as a child in a hospital.
Right. That's right.
Just came from nowhere, but that's because it's that the hippocampus is being activated. Okay, I think Sharon and then Avital.
Okay, so Sharon. So I wanted to just ask, like, I think for me it's a little hard to maybe figure out like where to suddenly fit it in. Like you're with a client for whatever amount of time and then you learn EMDR, and is it just for like, okay, so they just went through a trauma, or you've been discussing this trauma. Okay, let's try this and suggest it to them. There's also like, I mean, when we saw like a different demo, for example, like it's not just on big things. Like sometimes I don't think like, with what she just said, Tova, of like not liking her mother-in-law. Like, would I have thought to use EMDR for like a relationship, like being stuck? Like perhaps I'm like not so clear on what does it look like when an EMDR therapist like is with a client, like session after session, week after week? Is it that they're always using the TheraTapper? Is it that they're like sometimes in some sessions, like obviously different therapists are going to be different, but I'm just wondering, what does it look like? Like,
It is, I want to make sure we understand the question. Are you asking how to integrate it into therapy in a practical sense? Is that what you're asking?
I'm saying like, obviously, I'm assuming that some therapists maybe sometimes bring it in, like suddenly say, okay, maybe this time let's do EMDR, and other times they don't do it. And I'm assuming that other EMDR therapists are always, doing EMDR, like probably every session, okay? Like let's get on the TheraTapper. And then through the discussion, like it ends up being like that you do the protocol in some sort of way, like every single time. And then there's probably somewhere in between, like I don't know, like I'm just wondering like how to either weave it in with my clients or like suddenly like introduce it and
We got it. We got it.
do it
Anyone
more
want to
every
address that?
discussion or whatever. Like,
Yeah, we understand, Sharon. Anyone want to address that? Muhammad, you seem like you want to say something.
Yeah, I think it's a matter of, it's not like this is your shita and you do this on every situation that comes before you. It's part of your kit bag. Someone brings something up that is a trauma, then then you do it. I'm just saying also, see, I'm thinking about working with the one-off situations with the soldiers, and it's a matter of saying, have you been having any experiences that you're upset about and you really kind of can't talk about almost? That kind of thing, where you're feeling around for, is there a trauma here? Because this our main purpose, I think, in working with the soldiers, is to help alleviate their trauma. And
yeah.
it's not a matter of alleviating all of it, but it's a matter of, I mean, I come from like sort of my go-to framework is that solution focused framework. So I want the time that I spend with my client for them to get out of it the thing that they want most. And it's a matter of where they want to get, So if it's a matter of that they've had some upsetting experience, then then obviously EMDR could be a great thing to use with them. I would do that.
Let me just address.
Can I say something? Hi, me, it's Hamed.
Yeah, hi.
Hi, I'm a kinesiologist, and I use a lot of kinesiology and also bioergonomy, which let you know what's the right thing for the person by a test muscle. Do you know this thing, test muscle?
Mm-hmm.
So when I treat people, I'm asking the muscles, because the body, we believe that the body knows better what's good for the person. So sometimes that's what I do before I do EMDR. I do a test muscle. So whoever have this thing, who knows how to do a test muscle, can use it to know better what to do.
The body keeps the score. The body tells us that it's true. I just mention, EMDR is not something that you do every time, and it's a tool that's used when a trauma is presented, mentioned, or accessed, and then you could just say, "Would you like to do some EMDR on that?" And you offer that as an option. sometimes they'll say, yeah, I really would like to do it. And sometimes they'll say, no, I just want to talk about it. I just follow the client's lead as to what they want. If they aren't aware of the EMDR, I'll explain to them. I'll send them a YouTube, which I can share on the chat, so they can. It's a really good presentation by two therapists, and also the EMDR.com website, and then let them do their own research and then come back and see how comfortable they are. It's a tool like every other tool in your toolbox, but it's not like an orientation like CBT, where you have or solution focused therapy. It's not a therapeutic orientation. It's a specific intervention for trauma. At the same time, there are people who they don't have a TheraTapper, they don't want to have a TheraTapper, whatever. But if they're in the office, or if they have one and it's remote, they like to just get on it while they're doing therapy, because they find that they're able to process better, which makes sense because the bilateral stimulation is helping them to access the processing centers of the left brain. So they'll go on the TheraTapper while they're doing therapy, but we're not really doing the protocol. They just like being on the TheraTapper. And the other reason why people like to get on the TheraTapper is that if you remember that enzyme, that chemical gets released, that desensitizes the limbic system, it just calms them down, and they find that they're much more able to be present and attentive to what's going on, because the TheraTapper calms down their nervous system, kind of it desensitizes the limbic system in a way that they can really be processing in a more effective way, even though we're not doing the protocol. So you don't have to necessarily do EMDR. Once they're just getting on the TheraTapper alone can have a significant therapeutic value.
When I do IFS, I have them on the TheraTapper. And
Yeah.
I use it more when I need to, work with them relationally. I use the IFS, and then here and there, something will come up that I feel is like a really big triggering point for them, and then that's when we'll do the MDR within the IFS. That's how I put them together.
Yeah,
that's one of the ways, at least.
Talk about that. Avital, you've been waiting patiently.
Yeah, thank you. Yes. Okay. So going back to the structure, because I wanted to add something where I think it's a personality for the therapist, but also for the client. What I mean by that is that I had one person who actually, when we finished, I said how did it go, and she actually really liked that there was a structure. She actually made a comment of liking that there was a structure and that it didn't let her mind go too far. So that I just wanted to add in regards to that, and also to the point what you guys were making, and now it's like, if I can remember, with that you don't have to be it at every time. Meaning, with one of my clients that I did it with recently, I've been wanting to do it with her for quite a little bit of time, and I actually did send her over the information and research and everything like that for her to check out prior to, and it just whatever the sessions were, it didn't. So recently she had something about her throat, and it was like towards the end of the session, and we did the breathing and whatever it was, and she was fine. But then the next session or a couple sessions later, I said, you know what, she was experiencing it again about her throat closing up and things like that. So I said, you know what, and I reminded her about the EMDR. I'm like, would you mind? Let's do that. And we did it for a little bit, and I have to say that it was successful. Like, so to your point, where you're right, it could be on a specific, doesn't have to be in general. It can be like, okay, I noticed that her throat, every time she had anxiety or whatever it was, if there's a bigger picture to it that we won't get into, her throat starts to close up. So I was able to take that one specific thing and do EMDR on only that thing, if you will. And like I said, it was actually it went from, let's say, a 7 all the way eventually to like not even a 2. Oh. And she went to stop, and she was successful. She's like, I'm good, I'm fine. And like she was able to continue, and the session was like basically over, and we ended it, and we'll see next time what happens.
A really good example, Avital, of being attuned to a specific symptom, in this case, a somatic symptom that is disturbing. It's uncomfortable, and you can just kind of take you can segue to a desensitization paradigm of trying to get that symptom down, even though you're not necessarily doing the whole trauma protocol, but just identifying a somatic symptom that's disturbing to the person. It's a good example. I want to ask a general question for those of you who are doing EMDR and are finding success, like Nechama mentioned and Tova. When you see that EMDR can be effective in helping to transform a person's trauma or traumatic experience, what's it like for you experientially when you experience that? How does it feel for you to be able to have a successful EMDR experience with a client?
I think with anything, if I may to jump in, I think it's amazing. Like I felt great, and I was really happy that my clients were able to come in at a certain level that they were, and to come out in a much better position, if you will. But I think that's with everything. Like when you have a good session with a client, EMDR or not,
Yes.
knowing that you had a good session, it's an amazing feeling.
I think, Toby, you want to say something?
Also, yeah, of course, amazing. Yeah, amazing is the word. You're actually being instrumental in helping that person move on,
Yeah.
So it's great.
So
Fantastic.
I think that anyone else want to share who's doing it?
Yeah.
Yeah.
I just want to say that it's very personal, that is selfish in a way. I mean, I'm the reason that I'm so committed to EMDR is that I had such an unbelievable experience with it. So, and it's to me, it's the gift that keeps on giving, because even though I had this session now, it was a couple months after October 7th. It's like, it changes you. I feel fundamentally changed. And I'm not saying that I'm impervious to traumas, but just that I found it as such an incredible antidote to having a feeling, such a bad feeling about something that couldn't be, I couldn't speak about it. And I just, felt so in a very fundamental way, not okay with it. And then it became okay. And it became something I could just, keep at an arm's distance, but I could live with it, and I could be, a yacholti listaderim, I could get along with it. It could be, that you can have, we sort of in this world think you're healthy or you're not healthy, you're happy or you're sad, you're depressed or you're, happy, whatever. And that this is a matter of that you can live with trauma. And it freed for me, it freed me up from other traumas.
I think
really,
you're making a very, very good point. I think that perhaps what I'm missing a little bit is knowing how, like, to experience it as a client. Like, perhaps, I don't know, you or somebody else here would be willing to, like, I don't know, do an EMDR session with me and give me that experience. Like, I think it's a very valid point where you're saying, like, when you're giving over a modality with somebody else, to experience it on your own. Like, I know through my husband seeing, like, he actually is in EMDR therapy right now, and just between, us here or whatever, in this confidential space, hearing from him and knowing what he didn't really have the belief before, and generally didn't really want to go to therapy, and now he can't help but really, really, like, admit and say, look, I don't know, whatever magic it is, like, it's something powerful. And to hear from him, like, is a way for me to, like, wow, but still feeling it on your own is a different level. And I think you're able to give it over to a client in a completely different way once you've experienced it yourself. So
it just occurs to me that I would like to suggest, and I'm really putting you on the spot here in front of everybody,
not at all.
Norman, but I don't know, should I call you Norman or Dr. Goldwasser, whatever? I don't want to be disrespectful.
Just don't call me late for dinner.
Okay. I just want to suggest I would really love people, everyone as a group, to experience what I had in the way I was introduced to this. And it was done as a group. And it was done where I would give you tell you a little bit about how it was done, Norman. And, like everybody kind of does it to themselves in the group setting. And it's not a matter of everybody's telling about their trauma. It's just a matter of doing the bilateral stimulation. And, like let's say right now, we're not going to do this, but right now, everyone should think of the most traumatic experience that they've ever had. And then, guide us through it with the protocol and do that, whatever, with a TheraTap or tap ourselves, whichever thing. And, and we did, and what this facilitator did was we rated the trauma on a scale of 1 to 10 to begin with, and just showed by fingers what it was. And everybody did it at the same time. And then if you have an intense experience and you can't go on with it, you just bow out of it. And basically she was having meditative breathing when that happened. This was on the third go round. And then she met with then everyone else, she met with me individually. She said usually as a group she would do it 2 therapists, and it would be a pull-out person if there was anyone that had a strong reaction that was negative. So but it's really something to do it that way. And I think it's something that would be useful to learn, because I think that we should be able to do that with a group of soldiers, and probably do it pairs of us to do it, and it would be amazing, I think.
I'm coming back, God willing, in September. I'd be willing to meet, I think, to see if we could try this group experience. I would like to
I'm saying she did it on Zoom. She was in Alaska. Anyway.
I think I prefer to do that in person if everybody's
okay.
Yeah. Well, let me just, I want to go back to the question that I'm asking. There's nothing more disconcerting than if you're sitting with a client who's presenting a problem and you don't know how to help them. You feel very impotent. You feel inadequate. And once you learn the skill and you have somebody, because I know before I experiencing EMDR myself and learned how to do it, when a person came with a trauma, I just didn't know what to do with it because the conventional psychotherapy was not effective. And I think that once you really get EMDR into your toolbox and you feel comfortable, there's a certain sense of mastery over it. It makes you feel more confident in your skill set. And I find it empowering for the therapist to be able to meet a person where they're at in their trauma and to help transition them to a point where that trauma is no longer ruling them. It's no longer hijacking them. And they feel that tremendous relief that they can go back to the traumatic experience and feel neutral or actually feel positive. I just know that for me, when that happens, it besides just deep sense of satisfaction, you just feel you have more sense of agency as a therapist. And that's why I encourage those of you who have not yet started to dive in. Over time, you'll feel more confident, more comfortable, and you'll be able to feel the power of the impact, and you'll want to do it more. Okay, Any other questions or comments?
Were you going to give us the protocol for addictions? I know we were supposed to remind you.
Thank you for reminding me. I
I had it on my book to remind you weeks ago, but then we didn't end up meeting, and then I just spaced out.
Let me work on it, and when we meet next month, I'll present that. Okay.
Sounds good.
Thank you for doing that. By the way, Susan and I are planning on doing another training the week of September 8th. It's like 2 weeks before Rosh Hashanah. So if you know of colleagues who are interested, have them reach out to Susan. I'm hesitant to offer this, but if anyone wants to do this again, they want a primer, I'm happy for you to join in as well. That it would be repetition, but I know that that at least one person came to the second training that I did because they wanted to do it again. So offering that. But I think more importantly, if you know of people in your network who wants to get trained, this is going to be a good opportunity for them to do that. Okay.
Thank you.
Well, everyone have a good rest of your day. And
would you be thinking, I'm sorry, would you consider what Nechama mentioned, getting together and doing this group thing?
Yeah, I would consider it, sure.
I think that would be interesting. I think that would be very.
Okay, and let's schedule the next meeting. A month from now would be August August the 3rd, which is Tisha B'Av, I think. That's Tisha B'Av. So we're going to do August 10th. Would you want to do a week later or a week earlier? Because people leave
a week earlier, please.
Yeah, all right, so July 27th, we'll do that, okay?
Okay, same time, 5 p.m.?
Yeah.
Okay.
Thank you so much for your time.
Thank you.
Yes, thank you so much for your time, really.
My pleasure, my pleasure.
Thank you.
And if any of you want to practice EMDR on me, then I'm offering my
I'd be happy to. I would be very happy to, yeah.
Yes, thank you. Thank you so much.
Yeah,
so I'll message you.
You should, yeah.
Thank you very much. Okay.
Bye-bye.
Bye.
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 I'll send out, hopefully I'll send out the recording in the group, okay?
Thank you.
I also would like to train with you. If anybody wants to do it, then I would be glad to do it.
I would be happy to practice with people.
Okay, so let's meet.
Thank you very much, Nechama. Thank you.
Thank you, Nechama. Thank you.
Okay, bye everybody. Thank you for attending. Bye.
Thank you.